Good day. I am Dr. Yoshiko Ikeda Makiling, and I will be talking about COVID-19 vaccines. Do booster doses protect more? So, for this afternoon, I will be presenting the impact of COVID-19 vaccination globally, determine the importance and effects of booster vaccination in the adult population, discuss the classification of the coronavirus variants and its implication to the pandemic, and to present the current recommendations on booster doses. I have nothing to disclose. The COVID 19 was discovered in Wuhan, China. It was and is still very contagious and spread quickly around the world. It has mutated several times over and took 6.4 million lives and counting, with the Philippines currently racking up an average of 3,000 new cases per day in the past 7 days. In the Philippines, from January 3, 2020 to July 30, 2022, there have been 3.7 million cases with 60,718 deaths. This is the fifth highest in Southeast Asia behind Vietnam, Indonesia, Malaysia, and Thailand. Since the vaccination rollout in the Philippines, 163 million vaccines have been administered, with 63% of the population fully vaccinated by July 31, 2022. This is lower than the WHO target of 70% by mid 2022. That was 2 months ago. So it is also the lowest among the ASEAN countries. So I included here China, where it all began, Japan, and of course the United States, which also did not reach the target. This graph shows the deaths per million people due to COVID since January 27, 2020 to July 31, 2022. The first vaccine was administered in December 2020. The spike here from the UK was due to the Alpha virus sometime in January 2021. Asia noted the highest number in May 2021 with the start of the Delta variant, but generally it is less than one, which actually confused me as India recorded the highest mortality sometime in that year. So a year after the vaccine has been given, other than the US, we can note of a decline in mortality. Allow me to share this study done in the UK, released in June 2022. But the data included in this study was from December 8, 2020, when the first vaccination was given outside a clinical trial up until December 8 of 2021. The methodology is quite complex, so I will not dwell on it. So it aimed to estimate deaths averted by vaccination in 185 countries. And from this study, they estimated that vaccination prevented 14.4 million deaths due to COVID-19, representing a global reduction of 79% of deaths during the first year of COVID-19 vaccination. The estimated deaths averted were higher in high-income countries, reflecting the earlier and wider rollout of vaccination campaigns in these countries. And this was before the arrival of the Delta variant in the second half of 2021. So now that we know the impact of COVID-19 vaccination in the pandemic, the next question is, do I need a booster shot? The COVID-19 vaccines show excellent efficacy in clinical trials and effectiveness in real-world data. But some people still become infected with SARS-CoV-2 even after vaccination. And CDC calls this vaccine breakthrough infection. A study done in the Philippines from March 1 to July 15, 2021, clinically characterized PCR-detected breakthrough infections among partially and fully vaccinated cases, with majority given an inactivated vaccine, your CoronaVac, or what we know as Sinovac. They detected 182 SARS-CoV-2 infections among the vaccinated cases, with 129 classified as breakthrough infections. So majority were male, 30 to 39 years old. And this is explained by the demographics of the population tested, who are mostly active military service members. And most of them were asymptomatic or mildly symptomatic. And these results were similar to the Sinovac trials. Now, alpha, beta, delta, and gamma variants were detected at this time. The healthcare workers had significantly lower CT values, which means that they have higher viral loads compared to those who are non healthcare workers. The significantly lower CT values could be attributed to the continuous and sustained exposure of healthcare workers to COVID-19 patients, and this underscored the importance of regular PCR screening for healthcare workers due to the risk of SARS-CoV-2 transmission. And these provided evidence supporting the administration of a booster dose, especially to healthcare workers. Now, a bigger study done in the UK, published in Lancet in January 2022, also aimed to identify risk factors for post vaccination SARS CoV 2 infections and also describe the characteristics of post vaccination illness. And 6,030 adults received their first dose, and 2,370 received two doses of their primary series between December 2020 to July 4, 2021. And they found that post-vaccination infection were increased in frail older adults, supporting caution around relaxing physical distancing and other personal protective measures like removing your mask in the post-vaccination era, particularly around this special population, even if these individuals are vaccinated. So their findings also support booster vaccination. Now, an even bigger study involving 620,793 fully vaccinated UK residents were observed after receiving their booster doses. And after 5 months, they found that the vaccine effectiveness remained high among individuals younger than 55 years. But booster doses restored the vaccine effectiveness to levels higher than those seen 1 month after completing their primary series at 88.8%. The adverse reactions due to the booster shots were similar to those seen after the second dose of the primary series. So all viruses, including your SARS-CoV-2, they change over time. And some changes may affect the virus's properties, such as how easily it spreads, the associated disease severity, or the performance of vaccines, therapeutic medicines, diagnostic tools, or other public health and social measures. WHO, in collaboration with its partners, have been monitoring and assessing the evolution of SARS-CoV-2 since January 2020. And during the late 2020, the emergence of variants that pose an increased risk to global public health prompted the characterization of specific variants of interest, or your VOIs, and variants of concern, or your VOCs. Variants designated as VBM are actually VOI or VOC downgraded because they are no longer detected or are circulating at very low levels. However, these variants continue to be closely monitored to identify changes in their proportions, and new data are continually being analyzed. So your VOI are SARS-CoV-2 variants that are predicted to affect transmission, diagnostics, therapeutics, or can lead to immune escape. Um, Luckily, there is no currently circulating variant of interest. Now, your VOCs are variants that fit the definition of your VOI but have evidence of impact on diagnostics, treatments, or vaccines. They increase transmissibility and they have increased disease severity. Unfortunately, we still have Omicron as the variant of concern. How concerned should we be of the Omicron? So, if one person is affected with the Delta variant, this person will affect 5 people, and each person would affect 5 other people, whereas the Omicron variant would affect 4 times that number. So, how safe are we against this variant? A retrospective non-randomized study in Qatar published in May 2022 looked at 2,239,193 boosted persons with no previous infection between January 2021 to January of this year. At 35 days after the start of follow-up, the estimated effectiveness against symptomatic Omicron infection was 49% versus Delta, which was at 86%. For the for the Moderna group, the effectiveness against symptomatic Omicron infection was 47%. No data mentioned against the Delta infection. The effectiveness of the Moderna vaccine against any severe, critical, or fatal COVID-19 could not be calculated because no cases were recorded for the booster cohort. The messenger mRNA boosters, your Pfizer and Moderna boosters, were highly effective against symptomatic Delta infection, but they were less effective against symptomatic Omicron infection. However, with both variants, your mRNA boosters led to strong protection against COVID-19 related hospitalization and death. A study in Spain of 7 million people aged 40 and above who also had no history of a previous infection were randomized to receive an mRNA vaccine. And they found that booster mRNA vaccine doses were moderately effective at 51% in preventing infection due to the Omicron variant a month after administration. These results were lower than estimates obtained during the Delta variant, but these are just similar to the studies done in Israel, Qatar from the previous study, and Scotland. USA study estimated effectiveness at 66%, and the Canadian study estimated even lower at 37%. Now, the optimal interval between completing the primary series and the administration of a booster was not previously established. So, this study estimated the effectiveness of the booster increased with time since complete vaccination. So, from 44% if administered between 151 days to 180 days to 52% if administered after 180 days or 6 months. So remember that all the previous studies excluded all patients with a previous infection. So how does a previous infection affect my immunity? So this retrospective study looked at the effect of a previous infection and vaccination on the Omicron infection. So the large Omicron wave in Qatar started in December 19, 2021 and peaked in mid-January of this year. So we see here that the effectiveness of a previous infection alone is similar to those patients or to those population who received 2 doses of vaccine plus a previous infection, which suggests that perhaps the protection here originated from the previous infection, which provided a more durable protection compared to the short-lived immunity afforded by your vaccination. However, it is important to note that nearly all patients in this group received their second dose of their vaccine more than 8 months earlier. So patients who received 2 doses of vaccine alone were close to zero or had negligible efficacy against symptomatic Omicron infection. Now, booster vaccination over here was associated with about 60% risk of reduction. However, those patients who received their however, these patients received their third dose less than 45 days earlier. So perhaps explaining the relatively high effectiveness. If you look at the last group, the effectiveness of this group, or what we call the hybrid immunity, meaning you've had a previous infection plus booster doses of your Pfizer or Moderna, were noted to provide the highest efficacy against Omicron. So vaccination enhanced protection among persons who had a previous infection, but hybrid immunity resulting from previous infection and recent booster vaccination conferred the strongest protection. So, do I need a second booster? Now, it's important to note that the fourth dose studies were really came from Israel. No? So this first study is an open label, non-randomized clinical study, and this assessed the immunogenicity and safety of the fourth dose of either a Pfizer or Moderna administered 4 months after the third dose of Pfizer doses among 1,050 eligible healthcare workers. And I think they administered the second booster earlier at 4 months because of this was the time when they had or when they noted a high um, COVID surge secondary to the Omicron variant. And they found that after the fourth dose, both your mRNA vaccines induced IgG antibodies against SARS-CoV-2 and increased neutralizing antibody titers. Each measure was increased by a factor of 9 to 10. The titers is just slightly higher than those achieved after the third dose or after the first booster dose, with no significant difference between Moderna and the Pfizer group. However, the fourth dose did not lead to substantial adverse events despite triggering mild systemic and local symptoms, which they did not expound on. So, looking at the results, they observed low efficacy against infection in the healthcare workers, as well as high viral loads, suggesting that those who were infected were really infectious. So, they also concluded that the fourth vaccination for healthy young healthcare workers have only marginal benefits. Now, there are actually two studies from Israel that look at the effectiveness of Pfizer in ages 60 and above because previously they were young healthcare workers. So this time they look at those ages 60 and above at the time when the Omicron variant placed Israel at the highest number of deaths in the early part of 2022. And they actually both have the same results. So I chose this study as it had a bigger population of 1.2 million persons. No? So their conclusion is that the rates of confirmed SARS-CoV-2 infection and severe COVID-19 were lower after the fourth dose of your Pfizer vaccine than after only 3 doses by a factor of 3.5. But was only a 6 weeks study period. So what are the current recommendations and booster shots? So the US CDC have recommended a booster dose for everyone ages 5 years and older if eligible. In the Philippines, the lower age limit for receiving a booster is 12 years old as of the present time. And based on the studies in Israel, the US CDC interim clinical guidance now recommends that healthy immunocompetent persons aged 50 years old and above and persons aged 12 years old and above who are moderately to severely immunocompromised receive a second COVID-19 mRNA booster dose at least 4 months after the first booster dose. The Philippines Department of Health have followed suit. The European CDC recommend the second booster for age 60 years old. So it's older, 60 years old and above, and at any age if they were vulnerable. So these are those definitions for moderately or severely immunocompromised patients. And this is just to show you the simple vaccination schedule for most people. And as you can see here, the only vaccines allowed for booster, for first and a second booster are your Moderna and your Pfizer. And this is the COVID vaccine schedule for moderately or severely immunocompromised, and this can be easily accessed by the CDC website. Message, they estimate that deaths averted by vaccination is at 14.4 million deaths. And vaccine breakthrough infections can occur, especially with the era of variants of concern, currently the Omicron, but booster shots are moderately effective against symptomatic infection and highly effective against hospitalization and death. Now, hybrid immunity with at least one encounter being a natural infection provides optimal immunity. Now, given the future waves of SARS-CoV-2 infection that may be driven by new variants, The researchers of the earlier studies, when they first recommended the booster doses, suggested the need for the development of a new generation of vaccines that target a broad range of variants to confront virus evolution rather than a continued strategy of repeated boosters with existing vaccines. And until then, let us receive our booster doses as recommended by our government. Course, I will take every opportunity to share how proud I am to be Army. So when BTS was asked to comment about COVID vaccination, BTS Jin directly answered vaccine hesitancy, saying that he understood the fear of the vaccine because it's something new, it's something that didn't exist before, but that he believes that we are afraid of the past, we won't be able to make progress. So, with many people still refusing to get vaccinated, in this race, in this particular time of a soon to be history, the race between variants and vaccine is yet to be determined. And because many people choose to fear the unknown, refuse to learn and accept facts, if you have been wondering what your purpose in life is, if you have been waiting for the chance to make a change and leave an impact in this world for your children and loved ones, well, this is your shot. Take it. Thank you.